Okay, my multimodal presentation is over nursing. Nursing is unique because it takes a special person with a lot of patience and discipline. It's also someone that is kind, strong-willed with many more qualities, but most importantly, it's someone with a strong desire to help people in need, and that's what makes nurses so different or unique. There are many different types of nursing, which is what makes nursing such a broad topic. Some types of nurses include a registered nurse, surgical nurse, a critical care nurse, forensic nurse, and there's so many more. The most common nurse, though, is a registered nurse, which people often refer to them as just an RN. And to go along with the different types of nurses, there are different types of specializations for each different department. While surgical nursing is also a type of nursing, it is also a specialization for the surgical department in the medical field. So nurses provide around-the-clock care, and medical surgical nursing is the single largest nursing specialty in the United States. And a reason that surgical nursing is the largest specialty is because there are many surgeries going on a day with many different severities, so patients may need to stay in the hospital longer, or they need to have more intense care. Surgical nurses provide around-the-clock care to multiple patients, making sure all of them are taken care of and provided with all they need, while discharging and admitting new patients all at once. Continuing educations for nurses and other medical personnel is so important because nurses and doctors and all that, they have to keep up with the advancements of technology and knowledge so they can continue to keep up with the fast-moving changes in patient care. And continuing education can be defined by the nursing professional development scope and standards of practice as systematic professional learning experiences designed to augment the knowledge, skills, and attributes of nurses and therefore enrich the nurses' contributions to quality healthcare and their pursuit of professional career goals. So I added this picture in here just because I feel like it definitely shows how hard nurses and doctors and any medical personnel that they have to continue education and study and work together. So satisfaction rates and patient satisfaction rates, they are extremely important in the medical field, and a broad definition of patient satisfaction rates can be described as measuring the percentage of patients out of the overall treated ones that are satisfied with the healthcare services provided by the hospital or its medical practice. So patient satisfaction can stem from how they feel about the nurses and doctors, and if they feel that they have been a top priority to the medical staff while they were admitted in the hospital. And it also comes from if the staff is doing all they can to ensure the patient is in good hands and that they are performing at the highest levels possible. So I threw this one in here as well because this chart shows the scores that this specific hospital or place has received out of patient satisfaction. And in the areas of the nurses have always communicated well, same with the doctors, or the staff always explained about the medicines before giving it to the patients, along with their room and their bedroom were always clean, and the area around their room was always quiet at night so they could sleep well. So, just like any typical job, like a teacher, they're always getting evaluations done and being assessed at their skills. And nurses are always looking to improve their skill levels, and evaluation provides the opportunity to identify the weaknesses and strengths. So, the evaluation system should be valid, reliable, sustainable, practical, and just many other things just like that. But evaluation can help educational systems and not just nurses and hospitals. Assessments can actually help the education system because the results of the nurses can be sent to the institutions where they have studied at, and those institutions can improve teaching in those specific troubled areas, or they can teach in a different way or different ways. And then these are just the sources I used.